happens if they get infections, problems? Would they need to go to the NHS, or would you treat them? Right, let's go. Thank you for the scroll. Yeah, see, I get this. I do get this. I think this is talking about people who've like gone abroad or gone elsewhere for surgery. And I do get people sometimes who've gone abroad for surgery who want to have, I don't know, stitches taken out or aftercare, basically. And no, I would not treat them. I would not treat them. And the reason for that is the way it's set up in this country anyway is that we get paid for the surgery. So the surgery is a certain price, and the aftercare is included. It's part of that price. And so there isn't a separate price for aftercare. The price is for the whole package, the whole thing. Once you've got a patient, they're your patient and you look after them. And that is how we practice. And that is how we've been brought up, and that's how the medical system is in the UK. You are responsible for your patients, and therefore, once there is someone who's a patient of yours, you are responsible for them. And the same is so if you have it done abroad, really it is that surgeon's responsibility to look after you. So if you have it done abroad and say, look, oh, can me look after you? I'm like, no, not really. Number one, because I don't feel comfortable looking after another surgeon's work. It's his or her responsibility. And number two, that's not how you can't sort of, I might charge, £7,000, £10,000, £15,000. I don't know what, thousands of pounds for something. They might charge £1,000. What, I haven't really got a price for just the after. I'm not going to just say, okay, well, pay me £10,000 to do the aftercare. We don't have a price for aftercare packages. The aftercare packages include. That's why. Well, that may be. You have to look into what they're offering, but that may be one of the reasons that it's £10,000 here, and I don't know what the difference of prices is, but a different price in one place to another place. Maybe that there's different levels of aftercare, and unfortunately you can't just sort of bolt on an aftercare package afterwards. So yeah, you really you shouldn't really either be going to the NHS. If you have private treatment, I mean, the NHS will help you if you are ill. I mean, there's no question. If you're ill, if you're septic, if you're if you're ill, the NHS is brilliant. It will help us all. It's there for us all if we're ill. But as I said before, if you have a treatment by a doctor and there is a complication or an issue, it really, the first port of call should really be that doctor. And most would probably want to be the first port of call. We want to look after our patients. I don't really want my patients going to see another doctor with their problems. I want them to see me. I want to have an opportunity to fix it and to treat it from sort of moral and ethical responsibility. But also, I'm best placed. I did the surgery. I know exactly what I've done. One's bigger than the other. Well, that's because I struggled with one and it was a bit bigger, and it's not that it's swollen, or flipping heck, that's swollen. I know how big it was or small it was or whatever. I mean, I've done the surgery, so I'm in the best place. So really, if you have infections or problems, you should go and see your doctor who did the treatment. And I totally understand it, that if it's in somewhere far away, it's difficult, which is why I always say to everybody, it's best not to go far away. And that's the same for people who live far away coming to see me. I say, look, you know what, you're better off, because if you have a problem, I'll say, look, come and have a look. I can do videos. I can do, we can help and liaise with GPs in terms of prescriptions and things like that. But it's not ideal, and it would be better to have it done closer to home. So in answer to the question, no, I wouldn't do an aftercare type thing. So if someone contacts me having had surgery elsewhere, I would say to them, look, you really need to go and contact your doctor because they're really responsible for that. If you go abroad, there's no aftercare whatsoever. Okay, unless you stay in that country for a few months. Right. Okay. Yeah. So says Olivia.